All right, welcome everybody. We have Tina Wilson here with us from the Alzheimer's Association. She's going to be presenting 10 warning signs of Alzheimer's to us. Thank you for joining us at Leeza's Care Connection. And Tina Wilson is the Program and Education Specialist. And so she'll go share this information with us. Welcome, Tina.
Great. Hi, everyone. Thank you so much for allowing me to share some information with you that is significant for all of us that are either caring for someone with Alzheimer's or dementia, or for those who may have noticed memory loss and changes in themselves or others. As we get started, we'll have Q&A at the end of the program. However, if you want to jot something down in the chat, feel free to, and we'll make sure that we get to all of your questions without leaving you without information. So today we hope that you'll walk away with an understanding what typical age-related memory, thinking, and behaviors are. And I find that when I talk with individuals, we are often asked about, how do I know? Is it this or is it that? And so we'll have a thoughtful conversation about that. We'll look at understanding some of the warning signs of Alzheimer's and dementia, and then discuss some tips and approaches for someone who does have memory concerns, and how to talk with them and have a thoughtful, respectful conversation. We'll talk about early detection and the benefits of diagnosis, especially in this era of treatment, and then identify the types of tests that are available and assessments that are available for diagnosis, and then have some time to look at resources. Throughout today's presentation, we will periodically meet a fictitious family, and we'll be following the Garcias, and we'll follow along with Mrs. Garcia and her daughters as they discuss their concerns about their mother. And so we'll take a look at what that is for them, and for many of you, it may ring true of conversations that you've also had. So Mary is a 73-year-old widow. She lives alone. She's a retired teacher who's always been meticulous about caring for her home, and her daughters, Lydia, have recently noticed some laundry piling up, some things being not in order, junk around the house, mail and bills not getting taken care of, which is just not like her mother. And I can tell you from personal experience that that was one of the first warning signs for our family, with my mother-in-law, who had a similar background, and all of a sudden we were seeing drastic changes in her behavior. Worried about mom. She keeps losing things, and the house is a mess. And her sister says probably normal thing to do to forget things a little bit as we age. And no, I don't know. It's not unlike her. I wonder if we should worry. And they say, let's reach out to our neighbor, Dr. Salloway.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
Again, even though we talked about the family being fictitious, Dr. Salloway actually is a doctor, and he does work and support the work of the Alzheimer's Association. So just to share that with you. Get my mouse to come back here. Here it goes. So as I said earlier, we often get questions about what is dementia, what is Alzheimer's, is there a different? And so we're going to take a little bit of a dive to understand that and hear from Dr. Snyder, who is part of the Alzheimer's Association, to talk about what the difference between Alzheimer's, the difference between dementia, and why it's important to know the signs.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and
Well, I apologize. I'm not sure why we're getting a stop on this. Let me see if I can fill in for you. As we've heard, the disease is a progressive disease. It is telltale signs of Alzheimer's are the tau and plaques that form around the brain. I love the image of the trees because that's exactly what begins to happen. It's a clogging of those two systems, and it does look like it's just roots that are beginning to die. You can see a normal brain here, and then if we were to do and look at a brain afterwards, you could see the deterioration of the brain. I'm going to hope that the next one will go fine and not have a problem. I truly apologize for why it's doing this.
behavior.
There we go.
The brain has three main parts:
There it comes back.
the
There we go.
cerebrum, the cerebellum,
Sorry.
and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor to find out what you're dealing with.
So now let's talk about a little bit about the warning signs. Just a few things of takeaways. Alzheimer's is the most common form of dementia. It's estimated that those individuals that are diagnosed with dementia, 60 to 80%, it's caused by Alzheimer's. It's important also to know that there are numerous types of dementia, and when we talk about the umbrella term of dementia, it is just like cancer. There are numerous types of cancer, and there are with that, for each type of cancer, there are different approaches, but there are some similarities about the disease. And so there is a distinct difference between, and they're not one and the same. So often we'll be asked that question. So just for your reference. We know that early detection is important, and it's extremely important right now as we are in the era of treatment. We'll talk about that a little bit later, but right now I'd like to kind of look at the what the 10 warning signs are. The first one is memory loss that disrupts daily life. So a possible sign of its dementia, one of the most common signs of Alzheimer's is forgetting learned information. And it can include things like dates, birth dates, events, doctor's appointments. It could be asking the same question over and over again. And as a caregiver or a family member or friend of someone who's making this journey, it's incumbent upon us to remember that the person that's asking the question can't remember. And so we need to remember for them and not use the word remember. Just allow the same question to come over and over again, but also to be aware of it so that we can bring it up to the person and also bring it up to a physician. You have an increasing relying on memory aids such as notes. Family members might begin to help support things and manage paperwork and things like that. So that's not uncommon. I'll give you something that's pretty typical for many people is sometimes forgetting the names or appointments, but then being able to remember them right afterwards. The second warning sign is challenges in planning and solving problems. What's possibly a sign of dementia is difficulty concentrating, taking much longer to complete a task than normal. Someone who was an avid cook and did things with memory, maybe using a recipe now and or may not be able to follow or keep track with a recipe or a familiar task. Doing monthly bills. My mother-in-law was an amazing bookkeeper and had books and volumes of receipts. And then all of a sudden that began to dissipate. And so we knew that that was a concern. What's kind of typical age related is making occasional errors when you're doing household bills or finances for the house. That's very age related. It also can be very related to stress. So depending if you're having a stressful time in your life, that can also throw this off. But from an age related standpoint, just occasional errors that you can't regroup it. Difficulty completing familiar tasks. People living with dementia commonly have difficulty doing that. Driving definitely is something that we often see changes in, whether it's perception, whether it's not being able to see as well, which yes, it can be related to other things, but driving to a familiar place and getting lost, not remembering where to turn left or right. Organizing a grocery list, being able to go to your local Rialto or Albertsons or Vons and always knowing right where the aisle is and what your path is, and then not being able to do that. Remembering, your favorite games of either Skip-Bo or Gin or another type of a card game, and not being able to constantly remember. So when it impacts your daily life, that would be concerning. What's typical age related is occasionally needing help using settings on a microwave and recording a television show. I'm pretty good with the microwave and I'm pretty good with the television show, but now that we have surround sound and 4 or 5 other objects, we seem to have 7 remotes and I can never remember which one to use, which is why I'm glad that I live with younger people that can grab those for me, take them away from my hands, push a button and make the TV work. So I'm always very thankful for that added help. There's also confusion with time and place. People that live with Alzheimer's or other dementia can lose track of dates, seasons. They may have trouble understanding when something's not happening immediately, and also forget where they are or how they got there. My mother-in-law was a wanderer, and it was probably 3 years into her disease process that someone actually called us and told us that they found her sitting on a sidewalk crying because she didn't know how to get home. And that was the first time that had happened. So we took precautions to address that, but it was a scary moment for everyone. What is typical is getting confused about the day of the week and figuring it out later. I think many of us experienced that during COVID when our focus was not normal and there was no need to do certain things. There was often a time where I'd hear friends say, I don't remember what day it is because there was no reason to keep track of it. That's kind of a different situation, but sometimes when we get confused because we've taken a vacation and we come back and all of a sudden it's Monday and it's like, where did the weekend go? And so it's hard to sometimes remember that, but that's a normal part of aging. Trouble understanding visual images and spatial relationships. This one is very common for those that are showing signs of dementia. And the reason for that is because our vision changes when our brain is making a journey through dementia and or Alzheimer's. Sometimes balance is off. Sometimes we have trouble reading. Part of that is the ability because we were processing the information. It also may mean that it may feel like our eyes are changing and you may see someone take their glasses on and off and then rub them and then put them back on. And it's not it's not the glasses, it's actually, and it's not their eyes, it's how their brain is processing that information. They may have problems judging distance and determining contrast with colors, and that is significant, especially if someone's driving. It's also not uncommon for someone with Alzheimer's and or dementia to not be able to cross a threshold because it's a transition from a rug to a wood doorway or wood flooring. That wood flooring looks like a vast hole. And so to step into that abyss, none of us would do that if we were out on a hike and came to a cliff. And we wouldn't do that. We wouldn't jump into a hole. But that transition from a rug to a floor space that's different can feel like an abyss for many because our brain can't process the difference. What's typical is cataracts, and we do have a little bit of change in vision, so it's always good to know your baseline, but also know your baseline of the person that you're supporting who has Alzheimer's or dementia. Problems with words and speaking and writing. People may stop in the middle of a sentence. And they have no idea how to continue. They're kind of lost in that gap. They may repeat themselves often, struggle with vocabulary, have trouble naming a familiar object or using the wrong name. I often have people tell me that one of the first things they noticed was that someone couldn't remember the name of their watch. And they would say timekeeper or some other word to fill in for that, but they couldn't remember, or they would tap their wrist trying to struggle with what the name was of something that is so automatic we even forget that it's on our arm. What's age-related changes that we may notice that are very typical is finding the right word in a minute, but then it comes back to you and very quickly. That's a normal part of aging. Misplacing things and losing their ability to retrace steps. And I think that's the key piece there. Oftentimes things will get lost and people can't remember where they are. And then that can lead to that confusion and then blaming others that someone stole something, someone took something. That's especially true potentially if you have someone coming in to help you, to support you in the house who's not normally there, and you may know the person well enough to know that that's part of who they are. But prior to the disease process being identified, people saying, someone's stealing my things. I don't know what happened. I just set them down there. Someone must have taken them, and not having the ability to backtrack. What's normal is misplacing things from time to time, and then you can quickly say, oh yeah, I came in, I was busy. I normally hang my keys up on the wall, but somebody else distracted me, so I put them down. And then when you go to get them, you can retract those steps and find your keys. And that's a normal type of aging. People living with Alzheimer's may experience changes in judgment and decision making. They may use, especially poor judgment with money. We hear a lot of situations where someone may have bought something more than once or bought something from someone who has come to the door to try to sell them something. They often may pay a lack of attention to their grooming and keeping themselves clean because it's just not part of their daily routine, and it doesn't seem important to them as it was before. What is typical age relating would be making a bad decision maybe once in a while, like forgetting to change the oil in the car. We all know the consequences of that, but sometimes we forget that. But some of these others are decreasing poor judgment. And again, the key part about that is to remember is does it impact their daily lives? Does it have a significant impact on their daily lives? Withdrawing from work and social activities. I want you to kind of think a minute if you were watching someone go through this process and you found someone that normally was very engaging and wanted to go out and have coffee and wanted to sit for hours and talk, or would come to a make and take or a reading club, and that was something they enjoyed and that was something you enjoyed with them. When you can no longer hold a conversation or follow a conversation, sometimes you withdraw because it's just easier. People don't want to be embarrassed. They don't want to be a burden. So they'll withdraw from those activities. And so that would be concerning if you saw that in someone who was extremely active and extremely engaging, even if it was one-on-one, and you began to see them pull away. What's typical age relating is sometimes just not feeling interested in family or social engagements. And sometimes that's just as we age, and we don't always want to be involved with everyone. We'd rather be by ourselves. And it's not because of the inability to have a conversation. We just don't want to be involved in a lot of social engagements. Or we're overwhelmed sometimes when we have extended guests in our home, and we're very happy when they leave. It has nothing to do with dementia. It's just wanting to have some time alone. The last warning sign is changes in mood and personality. When someone is living with dementia, they may experience mood and personality changes. They may become more confused. That behavior may come across as suspicious. They may be depressed. There may be a lot of anxiety. And so being aware of that, and they get easily upset no matter where they are, whether they're at home or whether they're with friends, anytime they're out of their comfort zone. And their comfort zone is how they define it. And so you may see some changes there. What's typical age related? As we age, often we don't have the same patience that we used to do. One of my favorite examples of that, for any of you that might have watched Fried Green Tomatoes, where the woman was in the parking lot, and as she came out and she rammed into a car, and she says, "I'm old and I have more insurance." So there is that part about being a little bit more irritable. And so that can be a common age-related change. Let's kind of talk about interpreting the signs and deciding what to do next. So as we talked about earlier, Mary's daughters were concerned about the changes they had observed in their mom. They wanted to know more and see what the doctor said. And so this is their conversation, and I'm sure that if anyone's made this journey, it's a similar conversation. Did you take a look at the warning signs information that I sent? Her sister says I did, but I still don't know. Mom is showing a couple of the signs, but not all the time. How do we know, in fact, if it's serious enough to see a doctor? And let's see what our expert has to say.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
So just a quick recap of what we've already talked about. It's important to remember that as we know that the warning signs are a guide to help us identify memory and thinking and behavior that's related to Alzheimer's or other dementia. It's important to know that individuals may experience all or one or some of the examples to some degree. And also, if you notice these signs in yourself or someone else, it's important to ask or see a doctor. It's also important, and we'll talk about it just briefly, when you see it in someone else, to have that thoughtful conversation and say, I've noticed, and give an example. And this, have you noticed it too? And if they say, no, I'm just fine, you can either take that conversation just a little bit further, or you can let it sit and then come back to revisit it. Because sometimes it takes us a while whenever we have changes in our lives, especially when they affect our body, our mind, the way we engage in our world and with people, to have someone point that out. It takes a minute for us to think about, is that true or not? So just as a thoughtful process for the dignity of the person that you're having the conversation with, is approach it from a very caring point of view whenever you raise the questions. So as I talked earlier, we are in the era of treatment, and why that's so important is that early detection is important in that if we can pay attention to what's going on with our cognitive health and not dismiss those changes in ourselves and others, it allows us to take control and see what is going on with our brain, and then have enough data to make clear and appropriate choices regarding the changes that may be happening.
It's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So there's just a different perspective of seeing what both Mary, whose husband is making the journey with the disease, and as she began to reflect on it and shared that information with us. And then also just knowing that, again, sometimes we're not always the best judge of who we are, especially if there's the impact of Alzheimer's or other dementia, and having a thoughtful, reflective mirror in a friend or family member can make a difference in being having the disease diagnosed in the early stages. So what should we look at if you notice someone have changes? And we have 10 steps that we're going to review quickly about approaching and assessing the situation. A lot of times, especially as a friend and a caregiver or a family member, when someone is beginning to have an impairment with their brain, we have to be that detective or assessor to review this situation and see what data do we know so that we can help them make better decisions and support them throughout this. So one of the questions to be aware of is what changes in memory, thinking, and behavior do you see? And keeping a note of those, especially so that you can have data when you're talking both with the person, or if you're concerned about yourself, you have data what that is. So when you go to the doctor, you can share that and be able to reflect appropriately. What else could be going on? There are various conditions that can sometimes change memory and thinking and behavior, and they may be lifestyle changes that need to be done. We could have something, it could be something that's related to stress or diabetes, a change in medication. It could be a vitamin D deficiency. It could be something as simple to fix as a urinary tract infection that can cause us sometimes to have different behaviors. And that's also true for somebody who does have Alzheimer's and or dementia. So trying to think what else might be going on that could be contributing to that. And when that's ruled out, then you have more data to be able to look for clearer diagnosis. Learning about the signs and the benefits of early detection is important so that you can again have a conversation and knowing what topics are available. Notice any changes in the person that you're concerned about, and you're 30 minutes into knowing that because you already have learned the 10 warning signs, so you're ahead of the game with that. And then check, has anybody else noticed the changes? Often it's nice to talk to friends and family members. If someone is living alone, ask them, I've noticed this, have you? I'm concerned. And that way, again, you have more data to support that it's just not a runoff, that it's consistent over time. And then having the conversation with somebody. This is probably one of the greatest gifts that you can give anyone, is to be concerned about them enough to have a courageous conversation. And part of that is, who should be the one that discuss that, especially if it's a larger extended family. It could be you, it could be a trusted friend, it could be a combination of both. One thing to keep in mind is that when you do have that conversation, not to have it be feeling like you're ambushing the person. It's probably better to speak one-on-one or have one person talk. But this is one of the greatest gifts that you can give someone is to say, I'm concerned about you. Let me tell you why. It's important to me. I hope it's important to you. I'll be there with you. I'll go to the doctor with you. All of those reassuring types of things are very helpful. Um, Again, I've talked about who should have the conversation and the concerns. And you'll pick the person that's best to do that. You know yourself who that would be for the person that you care for. And also think about if you're concerned about yourself, who do you want to go to ask that question? Who's that trusted friend that you feel confident in having that courageous conversation with as well? And what's the best time to have that conversation? I always, I think that's true in conversations in general. Anytime that we are, especially sharing something that is potentially fearful, hard to hear, or even if it's something as joyous as asking someone to marry you, picking the right time is important, and that goes without saying for this as well. So having the right place to have the conversation where the person can hear it and digest what's being said. Plan ahead about what you're going to say. And we've talked about some examples of that, that you've noticed something or how they've been feeling lately. You don't seem yourself, and give examples for that. Even someone who says that they don't love data will appreciate having an example so that it becomes more real for them. Offer to go to the doctor with them so that they have someone else. I can always reflect on having to hear some bad news from a doctor, and my mind just stops. I'm frozen in time. And so having someone there with me, or being able to write it down, or ask the doctor to write it down so I can reflect on it later, is a great asset. So offering to go with them to find out more information. Know that you might have to have numerous conversations for it to set in, and be ready for that, and be patient with that as well. And then without a doubt, reach out to support. And the support would be both within family and friends, and then make the appointment to see your doctor. So we all know that our primary care doctor is our number one person, usually that navigates our world, healthcare world for us. However, there are specialists that are available that you may be referred to, a neurologist, neuropsychologist, a psychiatrist, all for being able to have a clear diagnosis and an evaluation. So this is just a quick list, and you'll receive some information after the presentation for these notes. So don't worry about jotting them all down, but we can get those to you so you can have some extra notes as well. We've talked about early detection. What we now know, and you'll hear a little bit about it, is that we do have treatments now that attack the biology of the disease, not just the behaviors. And so by having early detection, it's possible if you're still maybe asymptomatic and or mild cognitively impaired, that there may be some ability to have a medication or treatment that actually attacks the biology of the disease.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So again, just a reason again for early detection, just to recap, pay attention to changes in memory, thinking, and behavior that you notice in people. Remember that you should be definitely concerned when that's happening, and especially if it's impacting someone on a daily basis and interfering with who they are. If you see changes that are unusual in a person, raise and have that thoughtful, courageous conversation. Discuss the concerns that you have, and then discuss and help people understand and explore why early detection is important, not only for planning, but access to new medication that's available to attack the biology of the disease as well as manage the symptoms of the disease. So when we look at seeking a diagnosis, there are numerous steps. I do have a couple of questions for you, and you can either put them in the chat or we'll walk through a couple of them. So the question is there currently, there is no current way to diagnose Alzheimer's disease? I know you're on mute, but if you want to drop it into the chat, you can. So we can do our fact check here. So is it true? No, it's not. It's false. There are numerous assessments and tests that are available. It was a lot of discussion sometimes is about the only way that it could be truly diagnosed is in an autopsy. And there are numerous assessments and tests that can make it possible for healthcare professionals to diagnose Alzheimer's with a high degree of certainty. The possible tests that you can have, granted knowing your medical history, having a physical exam, and then there are laboratory tests, mental cognitive tests, and that are available. It's a good conversation to have with your physician about what's available. And I think it's important to also know that anyone over 65 that has Medicare, Medi-Cal, for when you have your annual physical, you can ask for a cognitive status test. It's free. And that can give you a baseline, just like it does with anything else. For those of us that, women that have that go for annual or every 3-year mammogram, depending on your age, that gives us a baseline. The same things for men who have prostate test. When we have a baseline, then we can look at changes. So it's important to look at those changes over time and take advantage of them, especially on an annual basis. So do dementia symptoms always result in a diagnosis of Alzheimer's or dementia? Let's look at the possibilities. So appointment has been made and we're going well. Mom's handling it okay. And her sister says, "Do you really think it's dementia?" And the answer is, I guess we'll have to find out till we have the diagnosis. But let's see what Dr. Salloway has to say.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So again, as we've talked about, the diagnosis may be something other than Alzheimer's or another type of dementia, which is very important when we begin to investigate the cause of symptoms. The stigma and misconception around Alzheimer's, like there's nothing that can be done, can sometimes detour people from getting a more thorough diagnosis, but getting information early allows us to make the appropriate steps, be able to plan, and be able to be in control of something that may often seem that we're not in control of, but to be able to plan and have the opportunities to make decisions. So what can happen next when you have that diagnosis? I called, but I got your voicemail. How did it go? I'll call you later, but definitely looks like it's early stage Alzheimer's. And the reaction, oh no, what do we do? And so let's talk about some resources that we have available that can help support individuals who are making this journey. So just to let you know a little bit about the Alzheimer's Association, first and foremost, we partner with amazing organizations like Leeza's Care, which is a wonderful connection for us to be able to have partners that are doing the good work right along with us to ensure that everyone that needs support can get support. Our mission is to lead the way in eliminating Alzheimer's disease through advancing in research, providing enhancements in care, and doing risk reduction about dementia, and then looking at promoting brain health. And we have a whole nother series on how to take care of your brain because even though you may have a family history, so that there's a possibility that your risk is higher. We do know that there are 10 wonderful steps that you can do to create a more healthy brain. And we can start that as early as, 5 or before 5 to be able to increase our brain health to ensure that we can reduce the risk of the disease. A few key things that I'd like to share with you is our 24/7 helpline. That number is 800-272-3900. What I love about this helpline is that there's someone there 24/7. We have clinicians that are highly trained and knowledgeable about the disease, can help with education, help with decision making, crisis assistance, and resource identification. It was a lifeline for our family. I often would have something happen when doctor's offices were closed and I couldn't get an answer. I could call the helpline when my mother-in-law wasn't able to or didn't want to eat anymore, and she had said that she loved food and she wanted to be able to do that. And so they gave us some tips about that. When she was having hallucinations and sundowning, I could call and talk about that. When I was just having a bad day, I was spent as a caregiver, I could call and talk about that as well. We also have a wonderful website, alz.org. It's online, and it has numerous things you can put from research to help to support to education to caregiver networks, for information for somebody who is actually living with the disease and being able to network with others that are in the same situation. But that's alz.org. You can type, there's a search function that's amazing, and you can put in a keyword and it will bring up all types of information. And then also our alz.org community resource finder. I like this because it's nationwide. So if let's say you're traveling with a loved one who has dementia and or Alzheimer's, and you want to be, say you're going to Disney World and you want to know if you could get a caregiver there, you can put in information and pick that up and get someone to come in and be with you, or you need durable medical equipment when you land there. All of that information can be found, as well as local resources as well. And then just a couple of other quick things. We are asking everyone, because we know that probably in your circle, we know that almost 1 out of 3 individuals may be impacted by this disease. If they're not personally impacted by the disease and that they're living with the disease, they're a part of a family that is. And so being able to help spread the word about how important it is for early detection, share our helpline, share the wonderful resource of Leeza's Care, because it takes a village to do the work that we do in order to make sure that no one has to walk this journey alone. And then just lastly, a couple of key things. If you'd like to volunteer with us, we are always looking for volunteers to help spread the word in a variety of ways. And then Trial Match is a way to find out about trials that are going on. And you can access that via our website at alz.org/trial match. And then our walk to end Alzheimer's is coming up actually in the San Fernando Valley, October the 20th. And if you'd like to join us or just come over, and the walk is a short little walk around Pierce campus. We will also be having one in numerous other 13 locations throughout Southern California, but you can go to our website there. All the money raised there goes into research and to support efforts like educational programs that we do, and that everything that we do is free, and so that money helps support that. And with that, I think I will stop this and see if there's any questions and take myself off of sharing.
Does anybody have any questions? It doesn't look like there's anything in the Q&A, but if anybody wants to put in any questions in the chat or in the Q&A, you're more than welcomed. While we wait for any questions, I also wanted to let everybody know that we are going to be holding a virtual dementia tour. It'll be in October 17th at 9:30. So if anybody wants to participate, it is in person and it is held here at Providence St. Joe's in Burbank. So if anybody has questions on that, you can either call the center or email me directly. I will put my email in the chat if anybody wants to RSVP for VDT.
I highly recommend that opportunity. It is just an eye-opening opportunity to be able to see what someone experiences, and even living with someone who had the disease. There were pieces that were just so amazing to be able to have that. I wish I had done it early on in my caregiving opportunity, so I highly recommend it.
Yes, thank you. Thank you, Tina. All right, so we have a message from Valerie just saying thank you for the great information. I don't know if there was a question that wanted to go attached with that, because she did say she was unable to answer. a question in the chat, but I don't know if that means she just couldn't
That
place.
may have been to a true or false question.
Okay, yeah. All right. All right, well, I guess there's no questions. Thank you so much, Tina,
Thank
for all
you.
the information. And we always love to have you guys on here sharing more knowledge.
Well, and we are so thankful for the partnership that we have with you. So thank you so much for the wonderful work that you do. And for all of you that missed the senior prom, I hope that if they do it, when you do it again, that you all put on your dancing shoes and come and join, because it was a wonderful experience. So
Thank you.
congratulations.
Thank you so much, Tina. We appreciate you.
Everybody have a great weekend. Do something nice and special for yourself. Take care.
Thank you, Tina.